Okay, good evening. It is 4:30 on Monday, December 13th, 2021. I'd like to call this Champaign-Urbana Public Health District meeting to order. May I have a roll call, please?
Looks like Kyle is just joining, so let's give him a second.
Perfect.
We are. Okay, roll. Andy Kornstrom,
Here.
Daniel Chenoweth,
Present.
Kyle Patterson.
Here.
Thank you. A motion to approve the agenda is written.
So moved.
Kyle.
Second.
I have a motion and a second. Is there any discussion? Hearing none, roll call vote, please.
Andy Kornstrom,
Yes,
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. We're at the point in our agenda where I'd like to make a special note regarding the changes to the makeup of our board. I'd like to welcome Kyle Patterson, the county board chair. He replaces the county board executive, Darlene Kleppel, after a court motion that ruled that he, as the county board chair, should be sitting on numerous boards, but specifically as the representative from the county board for the Champaign-Urbana Public Health District. So Kyle, welcome. If I misspoke to anything that happened there, feel free to correct me.
That's all right. Thanks.
Okay, thank you, Kyle. It's good to have you back. I have a motion to approve the minutes from the November 8th, 2021 meeting.
So moved.
Second.
I have a motion, a second. Any discussion? Roll call, please.
Andy Kornstrom,
Yes,
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. We're now at the point of our agenda for public participation. If anybody on the Zoom call would like to speak to the Board of Health on any issue, please use the hand raise function, if you will, and I'll just call on you in the order I see them.
Andy, I would like to speak if that's okay.
Go ahead. Did you have something you want to say to the board? I'm sorry.
I did. This is Chad Pruitt from Urbana. I'm on the Prairie View Ogden School Board. We've recently had a spike in COVID cases going through the district. And it's my understanding that ISB, or the State Board of Education, has given public health the authority to determine whether or not the school district can teach our children remotely due to whatever closings that we may have experienced. As of Friday, we had a few students test positive, a lot of close contacts close contacts that got quarantined, including a lot of staff. At that point, we, as a board and administration, felt that it was the best thing to do was to close for this upcoming week and hopefully go to remote learning for our students. Just based on the fact that the area seems to be having a lot of positive cases, and there have been plenty of cases that you kind of hear through the rumor mill that families are testing with at-home tests and maybe not going through the right channels. Whether that's right or wrong, that's not for me to debate. But anyway, we felt it was best for our community to close the school, at least hopefully get through the holidays, and then maybe after the holidays, see what the numbers look like before we reopen. It's also my understanding that public health is not really willing or able to, at this point, grant us the ability to remote learn. And that's a little disappointing in my opinion. We, as a community, have tried to get through this battle together, I guess. And it seems like we're almost working against each other in this particular instance. We feel like we need to close for our staffing and the health of our kids and the health of our community, but we want to continue to let the kids learn. So essentially what we have done now is we have closed and we'll be using emergency days at this point, which are essentially snow days, that the kids will now have to be in person again, either if we cancel spring break or we make the calendar year longer. I'm just asking and hoping that we can all get on the same page on this, because it appears like we're sending mixed messages. Last year, we were encouraged to close from Thanksgiving till after the first of the year. Our numbers were good enough and we didn't have any positive cases, and we felt it was safe enough that we actually were able to stay in class and teach our kids in person. Now that we do feel like that we have trouble in our school, and not just our school, our community, we decide to take the effort to close, which is, as you're well aware, sometimes not the best decision, I guess, popularity wise. We made that decision and we've closed, and now we can't teach our kids remotely just because we're not granted the access. I'm just begging for a little help here in this and help keep our kids learning. That's the end game for everybody. Keep everybody healthy and keep everybody learning. Thank you.
Thank you, Mr. Pruitt. Is there anybody else that would like to address the board? I'll give one more second, just to be sure.
Andy, I had a question.
Go ahead, Danielle.
So Mr. Pruitt, you were cutting in and out at the beginning, but I believe you are not representing Urbana School District or Unit 4, correct? Are you representing a rural district?
Prairie View Ogden.
Prairie View Ogden. I'm
Okay.
representing Prairie View Ogden School Board. We
Okay,
have three schools in 3 different locations, 14 miles apart.
okay. Yeah, and there's 2 different boards. There's the Board of Public Health, and then there's the CU Public Health Board. And my understanding is that Ogden is outside of our jurisdiction, correct? For CU Public Health.
It is outside of our jurisdiction, but I think in the case of, I'm assuming that public health applies these rules across the board, irrelevant of location. Would
I
that be
see.
right, Julie?
Correct.
Okay, so the public health administrator basically determines the countywide approach.
That's I don't want to speak for Julie, but I think that's accurate. Yeah.
Okay.
Correct. Jennifer Earl-Wace, do you want to have any input on this situation and how it plays out with the rules that we are to follow?
Yeah, thanks, Julie. So I'll let Jennifer speak about the specific situation because she's the lead for all the schools. But I do want to make sure that the board understands that we have a lot of cases in our community right now, and every single school district has multiple cases in them. So Prairie View Ogden is not unique in the increase in the number of cases. In fact, we have other schools which have much more or many more cases in the schools, including outbreaks and clusters within specific classrooms, in their sporting activities, and other activities as well. So with that being said, I'll let Jennifer speak about the specific of the school without giving any confidential information, because these are all active cases right now and we are not part of an outbreak as of yet. Jennifer.
Thank you, Awais. Yeah, just what Awais said, we have not identified any outbreaks there at the school. I've been working with Jeff today and on Friday both. As far as their numbers, there are no outbreaks that we can tell. If there were to be an outbreak, we would have those conversations, but as of right now, we just don't have a reason to recommend that they go remote based on the number of cases that they have.
Also, the CDC, the IDPH, and ISB for the last 2 semesters have come out with special recommendations for schools, encouraging schools to be in person. I know we were among the only local health department last year, as was mentioned earlier, that had recommended going to remote learning when we were starting to see cases go up. But
and there was no vaccination. That was the key at the time. There was no access to vaccination.
Right, but right now, IDPH and ISB have made special arrangements for tests to stay in school, which many school districts in our county have taken advantage of. And there's also modified quarantine, which allows people who are exposed but critical to the infrastructure that can be back to work during the time when they're exposed. So all of these options have been offered to the school, and they have decided not to accept any of those recommendations for trying to be back in school.
We can't just make a recommendation that goes against the guidance that we're given. You know, that's why we need to work closely together, you know, throughout the whole entire time and, you know, discuss. I didn't receive any calls about this weekend or last week or anything. But, you know, we have guidance that we have to follow as well. We can't just make up a different rule for one school and not another one.
No, and I respect all that. I'll give Mr. Pruitt just an opportunity to comment after hearing what Jennifer, and I appreciate everybody's input too, since we don't have a lot of interaction at the board level with community comment. If he wants to provide a response, I'll let him.
And I realize, I guess, that you guys have all of these rules in place for outbreaks and such. And I guess the frustrating part for me is I really don't care where it's coming from, whether it's coming from in the school, outside of the school. We have enough positive cases in our school, not just students, but staff that we can't replace because you can't find substitute teachers, substitute bus drivers, substitute cooks. That's where our bigger problem lies. It's not just the amount of students that we have positive, but the amount of staff that is also positive or close contacts. And it was an example to give was one of the recommendations on Friday was that we could allow some of the close contact essential workers to stay in and continue to work. One of those also tested positive Saturday. One of those could be testing positive today. That test result isn't back yet. All of those people could have potentially been at school again today, maybe spreading it, maybe not. It's just frustrating as a school district that we want to teach our kids and keep them safe, and we're not granted the access to do remote learning. That may not fall on your guys' plate or the rules that you have to follow. I understand completely. I can tell you as a small community, it's pretty frustrating.
Well, the one thing that we can do is, so I think what I'm hearing you say, and correct me if I'm wrong, is that the issue that you're having, because we're not having specific outbreaks within the school, which is one of our criteria, but you're having too many people in your school that are out sick or quarantined to operate it safely.
That would be correct. Not only just out sick, but out positive with COVID.
Right, either in isolation or quarantine. So, you know, the one thing that we could do is we could ask IDPH and ISB if there is any, you know, way that we could do that as a workaround from the guidance that we're given, because that is outside of that. So we could address that with them.
And that would be great. And I guess, and it may be just a complete lack of communication or breakdown between everybody. That is, I guess, what the end game is. We want to teach the students. We don't want them at home like it's a snow day. And as an administrator of the school, I feel like he knows his school and he knows his staff and he knows his students. And if he doesn't feel that it's safe, I mean, that's why we put him in charge. We're going to go with his recommendation, even if that means adding days. But if there's a workaround, that would be absolutely awesome.
Do you know if the school is doing the test to stay?
So we have 3 different buildings, not necessarily doing the test to stay, but any of the close contacts that were willing to go test went and tested. And some of those results are still pending, I guess.
Yeah, that's a different thing. The test to stay is a specific program to keep kids in school and out of quarantine.
They
So-
don't have to stay. Jeff said that when they reached out to Shield about incorporating it, they did not have enough consent from the parents. They needed to have 80% of the parents' consent, and they weren't able to get that many.
Okay.
That is correct.
So Julie, will you at least consider other options as we move forward. And I'll comment on this in correspondence because they reached out to me previous to the meeting. But if we could at least make that an option moving forward, that would be helpful. Or
Make
Jennifer,
what?
just so you mentioned about talking to IDPH or is
Oh, yeah. Yeah, we
Yeah.
can see if there's a way, because that's not in the, that's not part of what we're able to do right now, but we can reach out and talk to our contact over there and see if, but what we're not going to do is, pretend like there's an outbreak in the school or pretend like it meets the guidelines and go that way. But if we can get a workaround for this specific situation, that we will do.
Yeah, and I'll actually just give my comments now because I think since they're relative, and I mean, as you know, I fully support public health, and we have rules that we need to follow. I think it's reasonable to say that the school district, the population that encompasses Prairie View Ogden is probably not one of our more vaccinated groups of individuals. And I think based on Jennifer's point that the lack of consent just to test speaks to that. And so, I mean, at some point we have to be reasonable, I think, and I think it's important for a school district to have some level of autonomy, understanding that ISB and public health also have their responsibilities. My understanding is Prairie View Ogden is, they feel so strongly about it that they've canceled school for the week and they're going to make those days up later in the year. So whether or not they can or can't go remote learning, they have chosen to cancel school because they know their families and they know their district more. Now, I know that it gets into a big issue of other districts and, we probably have to paint with a rather broad brush, but it seems to me that it is more responsible to allow a district to go remote for a week to try to prevent future spread, no matter where that spread is coming from, in a population that for whatever reason has chosen not to vaccinate maybe as much as another population. Our goal is to keep people healthy. So I would just encourage whoever's listening, Julie, I guess primarily you, to pass on the message that we want kids to keep learning too. So that's just my position as a board member. I really don't want to punish a school for trying to keep people healthy, all things equal.
Right. And we can ask for that. But like I said, it's not like we can just say, oh, you can do remote learning. Obviously that all comes through ISB and the IDPH and ISB thing that they have worked out. So we have specific guidance that we say this meets the criteria or it doesn't meet the criteria. This does not meet the criteria, but we can see if, because they're going to close anyway, if they can do the remote learning.
Okay, thank you. Any other board comments? Okay, hearing none. Any other public participation? All right, let's move on to correspondence. I did note, so it's for the record, the school board and the principal from PBO did reach out to me. We've discussed everything in regards to that correspondence, so I won't bring it up again. Any other correspondence, Julie or the board?
No, I don't have any.
Okay, old business. Don't believe we have any new business. Treasurer's report. Ron, welcome back.
Thank you. The treasurer's report as of the end of October, we're looking at cash in the bank at $6,669,600 with a total fund balance of $6,845,160, representing 39% of our budgeted expenditures for the year, and that's exceeding our guidelines of 25%. We ended the fourth fiscal month with a surplus of $417,889. The revenues through those 4 months were just over 4.5 million, which is about 1.3 million under the year-to-date budget. And the greater majority of that is all within grants and contracts, almost all of it. Expenditures were at $4,119,410, which was a little over 1.7 million under budget. A greater majority of that was personnel and benefits combined, We have contractual services, we're under budget by 209,000, patient care under budget by 114,000. Supplies at 244,000, travel a little over 40,000, and the capital outlay was under budget by $281,330.
Thank you. Is there any questions for the treasurer? I'd entertain a motion to place on file.
So moved.
Second.
I have a motion second. Any discussion? Roll call, please.
Andy Cornstrom,
Yes.
Neil Chenoweth,
Yes.
Kyle Patterson.
Yes.
That passes 3-0. I'm going to combine the approval of payments to Board of Health appointees. Treasurer Ron Fields in the amount of $480, check number 2471, and Attorney Ruth Wyman in the amount of $250 and $1,500, check request number 2758 and 2760.
So moved.
Second.
All right, thanks, Kyle. Any discussion? Hearing none, roll call, please.
Andy Cornstrom,
Yes.
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
Thank you. That passes 3-0. Approval of reimbursement to Administrator Julie Pride in the amount of $99.57 for MPH Advisory Committee meeting on 10/6/21, expense sheet number 2559.
So moved.
Second.
Discussion? Roll call, please.
Andy Cornstrom,
Yes.
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
Thank you. That passes 3-0. Review of monthly credit card statements. Anybody have any questions, comments, or concerns?
No.
Hearing none. Approval of MFA agreement for Microsoft Azure Active Directory in the amount of $5,017.50.
So moved.
Second.
Discussion? Hearing none. Roll call, please.
Andy Cornstrom,
Yes.
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
That passes 3-0. Approval of amendment 2 to statement of work number 1 between CUPHD and Centene Corporation.
So moved.
Second.
I have a motion and a second. Is there any discussion? Hearing none. Roll call, please.
Andy Cornstrom,
Yes.
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
That is approved 3-0. Approval of subcontract agreement between CUPHD and Sola Gracia Farm in the amount of $19,199 for the period of July 20, 2021 to June 30, 2022.
So moved.
Second.
Discussion?
Just a quick question.
Yeah.
So it looks like this is an agreement to support community gardens at many of the schools in Champaign-Urbana. Is that correct?
Yes,
And is this the first year we've done this, or is it the second year?
this is the second grant cycle, but Sola was the primary applicant on the first.
Oh, okay. Awesome. Yeah, I just want to speak in support of the proposal. I also work with the Solidarity Gardens Collaborative, and we're really keen on helping to build capacity at the schools. So it's been a great program that I've seen. It'll be a super program going forward, and anything that we can do to grow food on location at schools, and preferably if Solidarity Gardens can help with distribution. We would love the Solidarity Gardens Initiative would love to distribute fresh vegetables to families when they come pick up their kids after care, like at the 5 and 6 o'clock hour. So Valerie, I'm sure we'll be in touch with you, but it would be really great to bring these two projects together and see if we can also do some fresh food distribution. And we're even talking about how we could do some prepared meals or help folks make prepared meals as well. So anyway, it's a very exciting project and I'm fully in support.
Great, thank you.
I too just want to note my support. Both townships actually in Champaign-Urbana ironically have gotten into the gardening business. And so we're all very fond of the movement. SOLA is an awesome organization that's a leader in our community. And so I think it's great that we're partnering with them as well. Kyle, do you have any questions or comments?
No, it sounds great.
All right, thank you. Roll call, please.
Andy Cornstrom,
Yes,
Neil Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. Approval of subaward contract between CUPHD and the Board of Trustees, University of Illinois in the amount of $20,000.
So moved.
Second.
Any discussion? Is it, assume it's for inspections, is that accurate? Or am I misreading it?
Sarah, you wanna?
Yep, it was basically, University of Illinois was coming up with a uniform food inspection report analytical tool so that they could come up with standard comments to make for inspection deficiencies.
Awesome, thank you, Sarah.
You're welcome.
Any other questions or discussion? Roll call, please.
Andy Cornstrom,
Yes,
Neil Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. Discussion of revisions to cottage food section of the Illinois Food Handling Enforcement Act 410 ILCS 625.
That's you, Sarah.
So I put together a memo, starting next month, Illinois Department of Public Health will be responsible for having a uniform set of guidelines for every local health department in Illinois, same forms and same approval process. It's up to each health department to come up with a self certification where they issue the license or registration. So I put that together. This definitely expands cottage food beyond farmers markets now. So I had a few bakeries that were kind of a little upset because they wanted it to be a little bit more in line with their permitting as well. So that's why I had proposed that according to the act, local health department can charge $50 per each registration.
Thank you, Sarah. I'm going to get a motion in a second, and then if there's any discussion, we can move forward. I'd entertain a motion in regards to the cottage food section enforcement act.
Second.
All right, any questions or discussion?
Just quick question on what we're voting on. So are we basically just voting on the fee rate for this?
Yes, there was no fee before that. In my discussions with all the other regional health departments, they're all going to do that $50 so that it's a little bit more in line with permitting. We're still going to have to review. It's going to require a little bit more enhanced review, almost like a plan review almost. And then they'll have to have certain standards met. So yes, this would be basically approval for a fee.
Okay, thank you.
You're welcome.
So it applies to vendors at farmers markets that sell prepackaged, refrigerated, or frozen food. So let's just use an example of a farmer who brings a freezer truck with frozen meat. He would now pay that $50 fee.
No, that is already established. Cottage food has always been limited to farmers markets. However, now cottage foods can be basically sold at fairs, festivals, public events, and online.
Okay. So how many licenses or however you want it, like how much revenue will you see with this?
Registration. Right now, we only have about 9 in cities of Champaign-Urbana, and I have 7 in the county. However, the phone calls have started, so I'm not for sure how many more are going to basically register because there's not the restriction anymore.
Right. Okay. Any other questions or discussion? Hearing none, roll call, please.
Andy Cornstrom,
Yes,
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. Thank you, Sarah.
Thank you.
Approval of revision to accountant one job description.
So moved.
Second.
Discussion? Hearing none, roll call, please.
Andy Cornstrom,
Yes,
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
that passes 3-0. Discussion and approval of 2 weeks additional paid time off for employees. I would entertain a motion first, and then we can ask Pat any questions we may have.
Quick question.
Yeah, go ahead.
I'm not sure what the motion is. Is it simply the sentence that says we move to add 80 hours of PTO for all full-time employees?
Pat, what would you like
That
to
is,
see out of?
yes, that is the understanding. That's what we're trying to accomplish.
Okay, yeah, for the purpose of the discussion, I'll move that motion.
Kyle, would you like a second?
Second.
Thank you. Okay, any questions for Pat or discussion regarding that? Go ahead, Danielle.
I just, I sent this question on email earlier today too. I was just, well, first off, what I want to say is it makes a lot of sense to figure out both with the labor market being what it is and the amount of work and the endurance race that has been public health for 2 years. It makes a lot of sense that we would be looking, the administration would be looking for ways to add some cushion and some support and relief for staff. And so I support it in principle. I had a couple questions. Looking over the spreadsheet that you provided, it seems like there are some folks with 500 to 600 hours that they have banked in PTO. And I guess what I had suggested on email, and I'll suggest it here publicly, is just, I think it's helpful to incentivize people using their PTO because that's what it's there for. It's there to get that relief and to incentivize people to take, do self-care and take mental health breaks and physical health breaks. And so I would encourage the administration to find ways to incentivize the use of the PTO. And then my second, and I don't know if it's relevant. I don't know if that first comment is relevant to the motion. We can certainly approve the PTO and make a recommendation that you look further into the kind of procedures around it. My second question is, it seems like the dollar figure for the PTO is almost $250,000. And I assume that essentially the dollar figure it's not additional dollars out the door. It's actually just less hours, that we would have available for staff. Like they would have more time to take if they needed it. And of course that would be staggered as the staff needed it. But it is the case that at the end, when an employee severs a relationship, there's usually a payout, and that's when the dollars really matter. So could you remind us what the policy is for payouts of PTO when an employee leaves the organization? What do they get, and are there limits or caps on that payout?
Generally, we have a policy that no one can carry over any more than 35 days of PTO. But right now we're running an emergency operation, so we're functioning a little differently right now, and there is no cap on that. So if someone were to resign right now, we would pay them out for their PTO up to the limit of whatever they have. We would pay them out for that. It's theirs, they own it, and we would pay them for that. I wanted to be transparent in this and to let you know that this is twofold, the PTO, the 2 weeks of PTO. One is for newer staff who don't have any PTO, so they will have access to some. We have a lot of newer staff that we hired within the last year that hasn't accumulated a lot of time. And the second is to allow our employees to cash that in at a later date after the first of the year, because this is being funded by a CDC crisis grant, and they are encouraging ways to do this to retain employees, because the labor market, as I'm sure everyone on the call understands, is pretty tight. And so they're encouraging us to use the funds that we get from this to do these kind of activities to incentivize our staff. So that's what we're trying to do.
Okay, so just thank you, Pat. That's really helpful. So actually, what's the size of the grant that we're looking at from the CDC?
Julie, do you know the size, or Mandy? I don't know the
Well,
size of the grant.
So let me talk. There's a couple of things to add on to that. So this is one thing that Pat's talking about, but the other thing is that there are a lot of staff who have accumulated a bunch of time because we can't take it. And so that's going to be a whole separate issue that we're going to come back next week about being able to cash that in now and not have to, store it up or lose it. But so we've got a couple of things going on. One is that a lot of staff are not working in their normal positions, right? So I'm normally charged off to 2 specific, grants or subcontract. And I've been working on emergency preparedness for 2 years. Same with Always, same with, a ton of staff, especially leadership staff who are in the EOC. So with that money is there, that is actually, regular money from the agency. We're just being paid off of grants, which is not normal. We're being paid off of these emergency grants. So there's that. And then there is the crisis grants and the other grants that are coming in. And the crisis grant, it's well over, Mandy, are you still on here? Do you know how much it is? It's one of them is 600,000.
That's what
I
I heard. But
yeah.
I wasn't sure. Yep.
Yeah,
I don't
it is.
remember.
Yeah, it's up.
Julie, you're on mute.
Have I been on mute this whole time?
No, just.
God,
heard
how
you,
did it
we
even
heard
go
you.
back on?
I think your pajamas might have hit the button.
Yeah, exactly. I just keep trying to figure out if you have ears. Do you have those ears, Julie? Okay, that's what I thought. That's very cute. Oh, you're muted again.
Now you're muted again.
The reindeer antlers hit the mute button.
It's muting on its own.
That's
So
weird.
it is very weird. But so anyway, the reindeer pajamas, yes, it is pajama day. Pat did not wear a hood with hers. So once you
have
wear a
pajamas
hood, I'm
on.
stuck with it all day. You can't really take it back off, unfortunately.
I really recommend it. It's very comfortable.
It is very nice, but yes, the hood is a problem. So anyway, so what part was I muted for earlier when I was talking about?
You barely muted yourself.
Yeah, we heard everything.
Okay.
So you were
Okay.
basically talking about how some of this is actually like paid for indirectly through grants for your leadership staff.
Yeah.
And then you have a large grant that might be $600,000 from CDC to help support this. And that actually, my understanding is that it's less trying to get people to use it, then you realize they can't use it. So you want to give them a different benefit, which is to allow them potentially to cash out a portion of the PTO, which would be like a bonus. It's like a hazard pay bonus or something. It's
Right.
it's an emergency response bonus. Okay.
Correct. So that's what the 2 weeks would be. It would basically be, especially and with staff that aren't full-time, that would be, prorated, but it would be, so if they need time, they would have that, especially new staff, because we have a lot of new staff constantly coming in, for contact tracing, et cetera. And then for other staff, it might be, they might choose to take that as pay, and they probably would. So.
Okay. Yeah, that's super helpful. And
but the other piece about the being able,
bonuses. What's that? Go ahead.
I'm sorry. But the other piece, which we'll talk about at probably the next meeting, Pat, you think? Would be.
I think so, but I think we can kind of summarize real quick.
Yeah.
A lot of staff, as you noted, Danielle has a lot of PTO time on the books. And as management and leadership, we've decided that after the first of the year, we did it again last year, but this year we're going to offer people to be able to cash out some of that, because if everyone started taking that time right now, or 6 months down the road, we're going to really be hurt as far as employees being here and so forth. So we will present that formally to the board, but that's kind of the idea, to at least give you a heads up on that.
Yeah, but normally we do encourage people to take their time, but there are just times where you cannot. You can. We're taking off days here and there, but it's not the same as going away for 2 weeks. That eats up a ton of it at a time. But it's that just hasn't been able, we haven't been able to do that for some positions, so.
Is it reasonable then to say that based upon the grants we got, that it's really, I mean, virtually no cost to the public health district?
It's gonna be covered by, yeah, it's not
Okay.
only the grants, but the fact that we've been being paid off of grants for 2
Right,
years, which is
right.
unusual. So, yeah,
So although these dollar amounts seem significant, it's really not. We're getting funding somewhere outside of our normal
correct.
revenue.
Yes,
Okay.
yes.
And just to be clear, the numbers that I put together on that spreadsheet doesn't include fringe benefits or anything like that. So that number is not calculated in there.
Okay. Any other questions or discussion regarding the motion that we currently have?
I'm gonna cash mine in and get an actual reindeer.
I think there's a place just north of here where you can get a reindeer that was flown on Delta from Alaska.
Oh, my.
You may want to check the ordinances in the city, though. I'm not sure.
Yeah. They allow chickens, but probably not reindeer in Champaign. You know about those Champaign people.
Mhm.
They're sticklers, stick in the muds.
Hearing no other questions or discussion, may I have a roll call regarding the discussion and approval of 2 weeks additional PTO for employees?
Andy Cornstrom,
Yes.
Daniel Chenoweth,
Yes.
Kyle Patterson.
Yes.
That passes 3-0. Last item on the agenda, pending grant contracts for the administrator to sign. I see none. Are
Nope.
there any?
No.
Okay, wonderful.
On there.
That being said, our next meeting, if needed, will be a study session on, December 29th, 2021 at 10:30 a.m. Our next board meeting will be January 10th, 2022, not 2021 at 4:30. If I have no other business, I would entertain a motion to adjourn.
So moved.
Second, but I don't think it's technically required, but
I like to just make it a formality to finish off the year. I won't go for a roll call then. Thank you all very much. Have a good New Year and Christmas, and thank you for the good discussion.
Yeah.
Thank you.
Thanks.
Good
so
night,
much,
everyone.
Steph.
Night.
It's tough times.
It
Thank
is.
you for your service.